Hi, and welcome to Module 3, Lecture 1 for Community Health Advocacy and Social Movements. Week 5, so we're looking at primary care and community health. We will describe the role of primary care in reducing chronic and preventable health problems, list barriers to primary care for vulnerable populations, demonstrate awareness of healthcare needs for individuals across the lifespan, and understand how patient care coordination can be used for patient advocacy. So week 5 readings and media, you have Colorado Coalition. This is a good video, please watch it. It'll give you an idea about the social determinants having to do with primary care. This article is great. It's about overcoming barriers to primary care for veterans experiencing homelessness. Good article. This video is from Pacific Northwest University and gives you an idea of primary care needs in rural communities in Washington State. And then the book. And I love that this primary care lecture coincides with chapter 3 of the book, which is about people's free medical clinics, because it's a great intersection of our lectures and our textbook on this chapter. So the main players in primary care are pretty much family medicine and internal medicine physicians, nurses, nurse practitioners, physician assistants, pharmacists, pediatric, OBGYN, and gerontology doctors, and nurse practitioners and PAs as well. Behavioral health providers, social workers, therapists, community health educators, and CHWs. So community health educators are CHEs and then CHWs. And I think we have at least one CHW in our class that I know. Allied health, so medical assistants, certified nursing assistants, and some of the other providers that work in outpatient clinics, as well as staff. And so these are the main players in primary health care. The front lines, and also patient advocates, which I didn't put here, but they're kind of in allied health and outpatient hospital and clinic staff. So that's important too. And cultural navigators that they have at Harborview. I'm sure I'm missing some, but basically the entire team who works on primary care. So primary care is at the front lines of medicine. And what I mean by that is often they're the first point of contact for a patient. So they might be the first to see early warning signs and symptoms of an acute or chronic illness. And they can play an important role in identifying the beginning of disease process. So prevention, I think we've already covered primary, secondary, and tertiary prevention, but all three are addressed in primary care. So in primary prevention, it's identifying and changing modifiable risk factors before the disease process begins. And so, for example, that might be diet, exercise, all types of behaviors or choices. And as we spoke about, it might be the available choices, not always the choices people make, but whatever it is, primary prevention means looking at those choices and preventing disease altogether. Secondary is early detection, screening, and things like that, and treatment of disease. And then tertiary is elimination of the condition at an early stage. So that might be finding a benign tumor and surgically removing it, or it might be something like that. So the barriers to primary care were addressed in the Colorado video. That's the first one, Colorado Coalition for Medically Underserved. And so what they talk about in the video is, and also what's also very much written about in your textbook for chapter 3 is income, education, immigration status, which wasn't in the video, but I put that in, race and ethnicity, and racism, because I threw that in there because of the videos you saw regarding the health disparities and low birth weight, and that they were looking at fundamental causes and how does this actually happen to certain sections of and different communities disparately. And so that was one of the fundamental causes, which can also be a barrier to primary care and going in to see your doctor. So it could be any of these: language, housing, having health insurance, or having a job that gives health insurance. Transportation is a big one that they mentioned in the video. Complex health needs. So someone who has multiple health conditions would probably have a much more difficult time showing up for their appointments or adhering to their medication treatment or whatever it might be. Or even following the behavioral health or the behavior change recommendations for lifestyle. So that's another one. Food access and hunger. So think about going to the doctor when maybe you don't even have enough to eat, and how visiting a doctor, even though it might be needed, is less of a priority. So that's also a barrier. So primary care across the lifespan. So in the Kushal article, she mentioned that the general age of homeless veterans in America is increasing. So what did she identify as the main transition in health needs for an aging population? So she said at first they were looking at infectious diseases, addiction treatment, and other more acute kind of problems that people would show up with. And they started seeing more need for chronic disease management as the population ages. So what does primary care practice look like for different age groups? For youth, for young adults, for elders? So we have a guest speaker, and this is the video. The sound isn't very clear, so I've also put her main points in bullet points if you can't hear it. She was one of our community health interview choices. Her name is Anita Alush. She's a colleague of mine from school, from my bachelor's program, and now she's an advanced practice registered nurse. So she's a nurse practitioner in East Palo Alto, California. She focuses on pediatric primary care for children and adolescents, and the population she's working with is largely Spanish-speaking, recent immigrant or migrant workers from Central America mostly and South America, and have experienced a high level of trauma as a community, especially if they're fleeing from violence or if they're living in a high poverty situation. And she identified this term that we'll get into later in the quarter in your other class in Introduction to Community Health. And we'll talk about adverse childhood events and what that does to physical health. But you can imagine that adverse childhood experiences cause a lot of emotional trauma, to say the least. So her video is here, please watch it. I won't play it for you during the lecture because the sound quality isn't great, so it'll be better off if you try to listen to it on your own. So our guest speaker, Anita, was talking about what primary care looks like for the different age groups. She mentioned pediatric, which is her specialty. She said they're working on mostly preventive care, immunizations starting at 2 months of age, getting the community vaccinated, weight and height and growth measures, checking normal development of the kids, of the babies. For adolescent and young adult, she said that some of the things they're working on are immunizations as well for HPV, access to confidential services for teenagers, for sexual health, drugs, alcohol, mental health, birth control. One of the ones that she recommends is Nexplanon, which is good option for family planning for young people. And the advocacy part is just letting them know it's available because many young people don't know about these options, and have a hard time finding out about it through other means than their health provider. So adults, she said, mostly, though it's not her area of expertise, she said what she knows about this is that her colleagues at the clinic are working on lifestyle, smoking, eating healthy for adults, exercising, managing stress at work. That's a big one. And the physical impacts of stress, cancer screenings, mammograms, cholesterol, diabetes, working on some of those chronic diseases. And for elders, it's blood pressure, managing chronic diseases, and maintaining a high quality of life while taking multiple medications. So that's some of the primary care issues by age group. She also had a lot to say about care coordination and patient advocacy, and she said that's a big part of her job and the role of all the primary care providers at her clinic. She said what she does is helping the young people, the kids with chronic conditions who are not making it to their appointments or taking their medications. For them, it's difficult to get to appointments, maybe because of transportation or some of the other barriers we spoke about earlier in the lecture. They don't speak English, and their specialty doctors don't speak Spanish. Scheduling is hard for young people, and a lot of what she does is advocating with specialists by fighting for appointments for her patients and other Spanish-speaking patients, even if they have many no-shows, which might mean they haven't come to many of their appointments with specialists who get upset and refuse to see patients. And part of her job is just saying, no, they've been trying to come, they want to come, they just have these barriers to showing up. That's not always their fault. So that's part of the advocacy that she does. Small behavioral health team who are trying to address all the trauma in this population is also part of the advocacy work that they're doing at coordinating care and providing the care. So that's just a little peek into primary care by a real primary care provider. So for vulnerable groups, we can take the example of the Kushal article. She found that simple interventions could increase the proportion of out-of-care individuals. That means people, the homeless veterans that she was observing in her study, by over 70% who present for primary care, when primary care is designed for needs of homeless. So the intervention, they had 2 interventions that they outlined in this study. The first one was a 30-minute health screen performed by a registered nurse, who then used those results to engage in motivational interviewing on the importance of primary care. The second intervention was transportation to a brief on-site clinic orientation, wherein the previously unengaged individual was introduced to members of the clinic team and given information on how to make appointments and contact the clinic. Both were low cost and low tech. Even though the second one worked better, they were both highly successful, and the 2 combined got over 70% participation. So I'll let you read the study if you haven't read it yet, and watch all the videos. And I'll see you in part 2 of this lecture. So until next time, see you!